So from your perspective, is your field of applied kinesiology changing and evolving?
Yeah, it's like science. All science is constantly evolving, constantly looking at new research, new techniques, and applied kinesiology is no different. So there's constantly research that's being developed by people all over the world, particularly in the US and Australia. We're learning new techniques, new modalities, new ways of putting things together, new protocols. So it's constantly evolving. We have to, otherwise we're falling behind. So our aim is to always help the patient as much as we possibly can. So part of our job is to stay on top of the current trends, the current techniques, the current science, and continue to develop that.
And how the research is conducted for treatment types that are very individual?
Yeah, you can't do what's called randomised double-blind controlled studies, which is basically the highest level of research, because we're talking about a patient. But with all research, it starts with one person, one patient. You might find something. And so then you start to look for patterns amongst other patients. And then you might get a handful of patients where you're seeing the same thing. And then you start to develop a particular technique. And then you can start to control it a little bit more. But the flip side of it is people are often always wanting research, but it doesn't quite work that way sometimes because we're talking about an individual and there's no two individuals that are the same.
And there's not the same treatment.
There could be different treatments on different patients. So it's important that we're continuing to develop and learn new things and continue to evolve as science evolves and things like that. But it's also very important to remain individualistic with a patient.